Doctors are learning new things about this virus every day. So far, we know that COVID-19 may not initially cause any symptoms for some people. You may carry the virus for 2 days or up to 2 weeks before you notice any symptoms. You're hot, your throat tickles, your eyes feel wonky, and oh no, is this it? Is this the coronavirus? Do you have it? Here are 13 signs that you might have caught coronavirus. 13. You feel confused. Doctors have observed neurological symptoms, including confusion, stroke, and seizures in subset of COVID-19 patients. If you're considered high risk, you may show rarer and more severe symptoms. The CDC considers new confusion or inability to arouse as an emergency warning sign. Do seek medical attention immediately if it sets in. If you or someone you know is experiencing any of these symptoms, call your medical care provider before showing up. You have a bluish face or lips. This is considered one of the CDC's emergency warning signs, as they advise you to get medical attention immediately if you see them. Cyanosis is the name for poor oxygen circulation in the blood that causes bluish discoloration of the skin. 11. You have flu-like symptoms. For most people, the coronavirus will be like any other flu or cold. Many people catch these illnesses during their lives and experience only mild symptoms. For a certain amount of people, there are no special signs or symptoms of coronavirus. In fact, that is one of the reasons why it spreads so quickly. 10. You have a loss of senses. 30% of patients have loss of smell or loss of taste as their first signs of a COVID infection. Because of the relationship between smell and taste, taste can also be slightly affected. It can take weeks to recover. 9. You have a dry cough. One of the most common symptoms is dry cough, which can be described as one without mucus or phlegm. If you notice a slight cough or fever, this would be reason enough to begin self-isolation, allowing a couple of days to see if symptoms manifest. It has been reported that the respiratory symptoms will worsen after a week, though in some cases the incubation period can be as little as 2 days. The cough to look out for is a new, continuous cough. This means coughing a lot more than an hour or having 3 or more coughing episodes in 24 hours. If you usually have a cough, it may be worse than usual. Number 8, you have a fever. Coronavirus often begins with a fever of 100.4 degrees Fahrenheit within 2 to 14 days of exposure to an infected person. 7. You have diarrhea or vomiting. Diarrhea, vomiting, and stomach pain may be more common of a symptom of COVID-19 than anticipated, according to the American Journal of Gastroenterology. Half the patients that were diagnosed complained of those issues in the study. Some patients may not have respiratory symptoms, and just digestive ones. 6. You have a sore throat or headache. Nearly 14% of cases studied in China had symptoms of headache and of sore throats, reports WHO. The virus travels to the back of your nasal passages and to the mucous membranes in the back of your throat. That's the place where symptoms, such as a sore throat and dry cough, often start. 5. You have chills or body aches. CNN news anchor Chris Como says he was shivering so much due to COVID-19 that he chipped a tooth. They call them the riggers, he said, adding that he felt like he was beat like a piñata. Researchers at New York University also discovered aching muscles are among the factors that could signal respiratory distress caused by the coronavirus. 4. You're fatigued. Some older or immunosuppressed individuals may not present a fever, instead presenting with other common symptoms such as a sore throat, dry cough, or fatigue. Fatigue is a daily lack of energy, unusual or excessive whole-body tiredness, not relieved by sleep. Fatigue can prevent a person from functioning normally and affects a person's quality of life. 3. You experience shortness of breath. Can't get enough air in your lungs? Extreme shortness of breath and respiratory issues are what is causing the increase in patients in the ICU. Increasing your immune system using vitamin D can help decrease the likeliness of the spread of bacteria and viral infections. If you are struggling for air and can't breathe, seek immediate medical attention. 2. You have pain in your chest. Persistent pain or pressure in the chest is one of the CDC's emergency warning signs. Seek medical help immediately if you feel it. This could be a symptom of the coronavirus or a heart issue, and tests can help determine the right course of action. Before our number 1, subscribe to our channel for more videos like this. Number 1, you have pinkeye. Conjunctivitis, or more commonly known as pinkeye, can present as a symptom of coronavirus. People should be cognizant of possible aerosol transmission with the conjunctivita and through ocular secretions, like tears. So that was 13 signs you've caught coronavirus. It's our public service message. Share this with your family and friends and loved ones. Be safe. Be healthy.